Welcome. In this session we will talk about home medication lists, and the way to look at medications is from the home is to click on this icon here that says Documented Meds by History. If you click on that, left click on it, a window opens that displays the patient's home medications as well as prescriptions. The prescriptions are listed as this prescription bottle, and the home medications are listed as this Documented Medication by History scroll bar icon. And here you can see the patient has been on metformin, glyburide, folic acid, Prevacid, multivitamin, and insulin aspart sliding scale. And what you also can see on the right side here is the dosing of the dose route frequency, and as well as the insulin sliding scale here. If you hover over it, notice you see the sliding scale. So this is the home medication list area. Notice how some of these are left empty because the nurse or the pharm tech did not know their dose, and the name of the med got put in, but no dose route frequency was recorded. And so we should be familiar with looking these up. If you were to left click on the medication, you can see the comments, details, history, when it was entered by who created it, and results if there are any. Most of the time you want to be able to manipulate these meds. So let's say, for instance, in your history taking you learned that they are on 30 milligrams of Prevacid. You notice how it says 15 one cap. You can right click on that medication, right click, remember, and modify it. And you can modify it by, when you click modify, this detail window opens where you can define caplets, route, frequency, duration, dispense, special instructions, maintenance med, notes to pharmacy, even order comments regarding this med. So here, let's say you wanted to change it to 2 pills. That would make it 30, and therefore you would click document history and notice how it would go to 30. So notice how there's now the Prevacid says 30 milligrams or two caplets. So that's how you would right click and modify any medication. So let's say for folic acid you knew it was 1 tablet, right click, modify, you'd select 1 tablet, PO, Q day. These are all left clicks, and then click document history. Okay, so you click document history again and notice how folic acid has information. Now let's say the patient told you they were never on glyburide. You would actually click complete, and that way it would remove it from the admission and discharge medrec. You could also click cancel DC, in which case you rightfully told them to stop it. So let's say they were having issues with their creatinine or something and you wanted to stop it. You would simply click cancel DC, which means you were on it and you were told to stop it. So you click cancel DC, click document history, and notice how under document history that medicine is now gone. Alternatively, metformin, they could have told you that they were never on metformin. It was a mistake. Someone has incorrectly put it into the medical record, in which case you could use void, wrong patient, wrong med entered, in which case it voids it. You don't need to put in a void reason. If you wanted to, you could, but you don't have to. And you could click document history and notice that that med is also gone off the patient's med list. And the last one here is complete. So let's say they completed a course of antibiotics. You would right click on the antibiotic. For in this case I'm giving an example of folic acid. You'd click complete, click document history, and notice how that medicine is also gone off the list. So it's important to know what the functions are. Modify is change the dose route frequency. Complete is they completed a course of a medication. Cancel DC means you were on it and you were asked to stop it. And void means you are incorrect med, incorrect patient. Please void the med. Now you can also add medications that they're on at home by clicking this add button. And you can then search. For instance, you can search for aspirin. The search window opens. You click on aspirin, click here on aspirin and click Done. And notice how the dose route frequency script window opens, where you can put in, left click on the dose and you get the most common doses, 81 milligrams orally, frequency Q day, and you don't need to put a duration because they're on it and it's a maintenance med. You click document history, and notice you will, if you click on the history button again, you see that aspirin 81 POQ days is listed. So that is how one would add additional medications that they were on. It's very important to make sure that you put in all the details of the meds and not just put in the name. Once you're happy, notice how this status icon now says green check mark, med history has been performed, and click Done to close the search box. And what you need to also look down here, you see in this gray box, you click on this medication history button. It says last documented, and it has my name on there. So hence you see it has the iterations of what it is on here and when it got recorded. Okay, and you can even click on prescription and it'll show you the prescriptions here. So all the steps that we have taken are recorded here in this med history tab. And with that, I would like to end the session. Thank you for listening.